All right, good morning. We're a little late starting. I apologize for that. We had some unexpected things come up this morning. All right, but we're going to start with, open the meeting, and we're going to start with North Country Health Consortium, who's here to talk about an opioid abatement request. And why don't we introduce ourselves and then we'll let you all do that, and maybe start with a little explanation of North Country Health Consortium, just for folks who watch these are on YouTube, and so it's helpful, I think, for people to understand that, and then what your request is. So Martha McLeod, and I'm the Commissioner for District 2. That's Northern Grafton County.
Wendy Piper, District 1, which is Southern Grafton County.
Katie Hepburn, District 3, and she really only has 3 towns, and Martha and I split the other.
Yeah, we have like 20 towns apiece.
But we have our one city.
You do,
Yeah.
you have the number of people,
have-
just.
I know,
no,
I
just
know,
not-
I know.
Wonderful. Well, thank you for inviting us. I did bring hard copies of that.
Perfect.
Great. Yep, thank you.
Oh, I can pass those down. I'll certainly let Lauren lead off by explaining a little bit about North Country Health Consortium, what we do and why we're here.
Thank you, Bob. Good morning. I'm Lauren Pearson, and I serve as the Executive Director for the North Country Health Consortium. We are a 501c3 not-for-profit. We are the regional public health network for Northern Grafton and Coos County, and have a number of programs that fall under that purview with our contracts with DHHS. We are also one of 2 federally designated area health education centers in the state of New Hampshire. So we are the northern counterpart to our southern colleagues. We have programs such as Grafton Drug Treatment Court that we've operated for a number of years. We also have a robust community health worker program, and just added a community health worker and doula program. So kind of delving into the perinatal space around maternal health care as well. So number of programs, number of initiatives. At any given time, we operate anywhere between 30 and 35 grants. So we are a grant funded organization. This initiative that Bob's going to share about is a grant funded program, but there are limitations to that contract that we'll be sharing about. So these funds would really help supplant some of the areas that we're not able to cover with those grant funds. So thank you for having us today. It's an honor to be here with you.
Thanks, Lauren. And I do want to mention, this is a joint proposal really between the consortium and the alternative sentencing programs. The goal was every bit as involved in putting this proposal together as we were, and it just kind of organically grew. I mean, we've had a very strong collaborative working relationship for years. We rent office space in the alternative sentencing building. We share office space in Lebanon. Piggyback onto the office space available in Plymouth, and there's a lot that our program has in common with the mental health court, as well as a number of other programs that operate out of that building. And we've actually had alternative sentencing folks come in and teach life skills to our participants, and so there's a strong collaborative history between the two. And in conversations, it's like, we're really struggling right now. The biggest change that we've seen over the last, say, 8 years, and we've been the program administrator for the drug court since 2018, but in particular over the last 6-8 years, the mental health disorders that we see coming into the program and the challenges we face from the mental health side are pronounced. And some of it, quite frankly, can have to do with the incredibly toxic chemicals that are used now to produce in giant labs outside of our country. Methamphetamine is just one example. Psychosis that can spring up from ingesting methamphetamine that's been produced with certain chemicals. And it's just across the board. The stronger opioids, the more addictive qualities, the stronger methamphetamine, and the toxic chemicals that can actually create what's called meth-induced psychosis. It's incredible. So we'll sit around the table with the multidisciplinary team, which of course includes the judge and probation parole and Chief Smith and county prosecuting attorney, county defense attorney, and to a person on that team, we say, 100% of these clients need mental health supports. Our substance use disorder treatment supports are robust. But if you can't get to where some of our participants are with trauma-induced history and address that at the mental health level in an effective way, you're not going to be as satisfied with the results at the end of their program. And it takes a long time and really striking when the window of desperation is open with some of these clients is key. And we've got to get insurance established, wait times gone through before participants can access some of these services. There are a lot of social determinants of health that need to be addressed first once they get out of jail, as I'm sure you can imagine. Where's the transportation? Where's the housing? Where's the food? Where's the Medicaid? Medicaid has changed drastically. I'm sure you all know that. This is no longer a medically frail participant profile, which used to be an automatic declaration on a Medicaid application. We're no longer allowed to call these candidates that become participants medically frail. So we want them to get to work, and at that point, they don't have any insurance, and the co-pays are enormous. And that's also contained in the proposal, a way to help some of our Blue Heron Neurofeedback substance use disorder provider agency. They have co-pays. They are private. They're not in the same category as some of our behavioral health providers that are funded through the state, like Northern Human Services and West Central and Mid-State. We do a lot of work with them, but we also do a lot with Blue Heron, and they have co-pays that need to be managed. And so a lot of our funding is really chewed up with some of that. I spent over $16,000 last fiscal year to help with co-pays. And that never used to be there even 3 years ago. So we're really looking at ways to bolster the program, as Martha said, find ways to cover some of these needs that we've both identified. And I definitely would love Nicole to share a little bit about how this program could possibly benefit them.
So we've spoken about this in the past. We're collaborating with drug treatment court, mental health court as well. So the barriers that come with our mental health program is that we get referrals in and we have to stabilize them in the community before we can plea them into the program, which often means they have to be diagnosed, and getting them access to a community mental health center takes time. And then it prolongs the ability to get them into the program. So we're looking at the use of this provider to offer mental health evaluations and diagnosis, treatment recommendations, so that we can get moving on the pleading in of the clients. But not only that, and I know that this is true for drug court too, so you can chime in, but the other part is offering interim services. So interim counseling, skills-based therapeutic interventions for people while they're waiting to get into community mental health centers, because that's the goal. All of our programs, the goal is to establish services in the community. We don't want to hold on to them for a very long time, but we're finding we're holding on to people longer and longer because they're so unstable. The mental health provider would do the interim therapeutic service. We also would really like, and the conversation has included groups, right? Because that's a better way to couch a larger group of people and teach symptom management and identify diagnoses, and know what you are dealing with as an individual and how you can use skills to help specific to you. So the goal for us collaborating are those things, which we cannot get in short order anywhere. So the challenge has been, trying to get people quickly treated so that they can be more successful sooner in the programs and get back out into the communities and be productive members of society. What we end up doing is elongating their treatment programs, while we're waiting for them to stabilize. And I think we've talked several times, I'm gonna talk about it later, about the amount of hours and time that the mental health court team puts into people that are referred to the program, but they haven't pled in yet, just to get them wrapped around in a way that will allow them to plea in. This position would help with that immensely. So that's what we're hoping for.
So it really serves both programs. It could really serve both programs in a major way. And so that's why we sent the proposal in, and a 3-year proposal was kind of recommended, and that was what our thinking was anyways. We're gonna go out and hire a full-time mental health provider. We really want to make sure we've got some stability with the job. So it is a 3-year proposal. I understand where you guys are at, a little bit budget wise, but at the same time, we wanted to identify the needs and propose the solution that could address those and allow us to really get to work on the sustainability plan during that 3-year period. Once somebody's in place and we're seeing these really almost immediate catches with them and the assessments and the interim therapies that we're able to provide during that, what could be as much as a 6 to 8 week wait time. You know, that'll give us some time to really take a close look at how we could probably find ways to sustain this beyond a 3-year period. But for now, we felt like that would be a way to get this, you know, job share up and running. And so, and I know, you know, we've got some letters of support in there too. One of them, Chief Smith really wanted to check with the commission at the state level, and we got on this commission to make sure it wasn't gonna be conflict of interest for him to write a letter of support. But I speak for the multidisciplinary team also. They're all really hopeful we can make some inroads to help these participants. The end goal is the same for both programs. Stabilize, successful completion, assets to society right here in Carroll County, connected with county services so they can continue to prosper.
You're asking Grafton. You said Carol.
Did I say Carol?
You said Carol.
Uh-oh, spoiler alert, guess where I live.
Questions about, let's start with questions about the proposal itself from the commissioners.
No, I thought it was well written, lots of them.
Yeah, I don't think I have, it's very well presented. Thank you.
Yeah.
Very clear.
And Nicole, I really appreciate you being here. It's really helpful. Here, where would the person be placed actually? That you,
We talked about, again, it's office share, so they
Yeah.
would base out of, I think the Littleton space, but because it serves the entire county, again, it's, it'll be Plymouth, Lebanon, North Haverhill, Littleton, based on where they will travel to
wherever.
to wherever, yeah. So North Country Health Consortium has some space in their building, and then we have the other office spaces. So we can support them wherever, whichever part of the county they need to be in.
I had one more jumped into my head and now it's jumping out. Can you talk about how this might prevent people from either going to the DOC or returning to the DOC?
Sure, currently, we've identified, since 2022, the graduates out of the drug court program, Grafton County, have had about a 65 to 70% success rate at remaining drug-free and without any criminogenic recidivism involved, since 2022.
That's pretty good.
Yeah.
And that was a search done by both our program coordinator, Rob Atkinson, and our chief probation and parole officer, Amanda Perry. And it's still a small enough pool where they kind of know what's going on with these people. And so 65% is great, but then we've also taken, well, are there any commonalities with that 35%? And sure enough, they were the strongest mental health challenges that we observed coming into the program. I can't even tell you some of the mental health trauma-induced challenges that our female participants come in with, and to think that that can be solved with medication that comes from a psychiatric nurse practitioner, which we value, but without regular therapeutic interventions or mental health issues, it's unrealistic. And so the profile of the unsuccessful client was also something we discussed.
Well, I would say for mental health court too, and we know this, but the DOC is not the place they should be. Because they don't get supports and treatment the way they would if they were out. And so management of symptoms, it could include medication, of course, but management of symptoms and skill building. And that's the thing we're looking at the most, is how people can build skills in real time while they're in the community, facing the stressors they face, and have that support right in place beside them. That reduces recidivism when people know how to handle their stressors. We're not coming across that as much as we'd like to be. So we'd like to fill the gap.
Rob, do you want to introduce yourself and say anything?
Yes, hi, my name's Rob Atkinson. I'm the program coordinator at Grafton County Drug Treatment Court. So yeah, you mentioned reducing recidivism, and that's one of our biggest things is, like Bob was saying, we're really looking at those people that didn't do so well after the program, and a lot of it is pointing towards mental health. So we're really hoping to get those participants engaged in community-based mental health services like West Central or Northern Human Services. And we want them engaged in those services so that they continue engaging in those services after the program. Because once they finish up the program, a lot of the supports from us will end, even though they can always reach out to us, but they feel like they say they're free at that point. But we really want them to be engaged with the community mental health services and continue getting those services so that it will boost their chances of being successful.
What's the most common length of time that somebody is involved in your programs?
18 months for mental health court.
In our, the drug treatment court, 18 to 35 months.
Oh.
So we get a decent amount of time, and then substance use and mental health go hand in hand. So for us, ours is primary substance use. They come into the program, but once we get them in and they start going down the right path on that, a lot of times that's when a lot of the mental health stuff really starts showing up. And then we try and help them with that.
Interesting.
And you're right, Martha, 65%, that's not low, that's really high.
Yeah.
Usually, I think it's something like 56 to 58%. So we're happy with the results, but we've certainly been able to identify how we could do better.
I was just responding to 18 to 36 months.
Yes.
It's good to hear that. That's a good amount of time.
Mhm.
But then I can understand how you're uncovering other things. That's
Yeah.
just-
So some people, we don't want to uncover other mental health stuff until, well, the year end.
Oh, my goodness.
Yeah.
But, and I also heard the assessment piece of it is what keeps people from actually getting into starting down.
So for mental health court, everyone needs to be assessed and have a mental health diagnosis in order to plea in. We need to be identified. So that's a huge component, and that's the hardest thing to obtain. And then I think for drug court, it's the symptoms present themselves and they need immediate support. And until they can get into a provider, they need those interim treatment modalities. And so it's kind of a 2-for-1. I think it would be incredibly helpful to both programs. Not all of our participants have underlying mental health concerns. people who struggle with substance use disorders most often have an underlying mental
Mhm.
health concern. So it's not a shot in the dark. It is across the board a need, and so both of our programs have substance use providers, but it is outside of our scope of practice to treat mental health. We can connect it with substance use disorders, but when you want to dig into trauma, that's not my role as a LADAC. It's not Cassie's role as a LADAC. And so I know that Blue Heron also has substance use providers that are doing a fantastic job. It's just this empty space.
I hate to ask a really basic question, but I understand that you're, what is it again, the nonprofit, what's the number,
501c3.
501c3, I was missing something. Where does the grant money that you get, where does it come from? Do you get from the state?
It is a state program.
Okay,
It's from
DHHS, yeah,
a different division of the state.
yeah. And how much how adequate, I mean, I understand that it's not adequate, but how adequate is it?
You can probably speak to that as staff who are on the ground. I can say from my perspective, it is not adequate. It's been level funded for several years. As you know, costs are increasing.
Right.
There are other things that we are not able to build a grant for. So, and the scope can change year to year, but the level funding has been problematic. And it really limits our ability and the number of participants who we can serve.
Right.
And so that has proven, and we will be level funded again for this next contract cycle.
And we actually feel fortunate about that a
Yes.
little bit. Most the other drug courts have had a reduction.
Exactly,
in,
yeah.
Funding available, and it's, I think, recognizing the success of the Grafton County Drug Court, that is the reason we're level funded. But yes, cost of living adjustments go up every single year. That was a big hit to take for all the copay that we've had to do. We've had transportation issues we've had to overcome, a lot of housing issues that are really hard to overcome too. But our budget is got a pretty high amount of travel, and we're always needing more. And so it's been tricky. I mean, we're grateful for it. For sure. But with a program coordinator and 2 case managers for a $375,000 grant funded initiative, I know you guys know enough to do the math and understand that the importance of indirect funding into the consortium and what's left.
What are your predictions around the changes to the Medicaid program and how that will impact this population?
Oh, we haven't really had in-depth conversations. It's going to be interesting to really see how that gets impacted. It's the voiceless that bear the brunt of these changes. And so we will do our best to help that population and continue to forge ahead, knowing that there has to be a solution somewhere that can help our participants. It's so hard to imagine some of our super high need, high risk population being at a place where they are successfully reintegrating back into Grafton County society without healthcare.
Yeah. I wondered, and even the premiums and copays for Medicaid are going to become a challenge for populations that don't have a lot of income to even survive on. Yeah.
I know you know enough about health insurance to know that when these people come out, they get full-time jobs and they're counter help in service industries and end up eligible for health insurance. It's not a super affordable policy for them. They've got copays that are just.
Well, even the premiums often that they pay in addition to whatever their employer might pay is sometimes the difference between housing and having health insurance, do you make that, how do you make that decision? It's tough.
Yeah, health insurance is critical for our population because they do urinary analysis multiple times a week. They have treatment groups.
Yeah.
They go to a LADAC weekly, so they use their health insurance for a lot of stuff. And in addition to normal stuff, PCP, a lot of times they need dental work. So that comes through a lot of it. And then when we first get them, they start on Medicaid usually, but as soon as they start working, even if it's an entry level job, then their Medicaid gets shut off. And then try and get either insurance through their employer, which a lot of our people work construction, so they don't necessarily have insurance that way, so they have to go online through the portal. And it's like, how am I gonna pay these co-pays? It's so expensive. How do you
Yeah.
guys do this?
Yeah.
So it's a struggle.
Any more questions about that?
No, thank you.
So I think, I did talk to you all this morning. Don't think we even have enough for 1 year of this program, which, I think sounds really very important for our county. It's a countywide program and it sounds very important. What we've been looking at is asking the state opioid abatement fund to see if we could respond to some RFP. They say they're putting an RFP out on April 6th or discussing it to then go out after that. And, we would like to apply for some funding based on we're getting a lot of requests. Some of them are small. This one's probably the largest. We have funded some of the smaller ones with the first responders because it's an immediate kind of need. But Julie's going to give us an update on the funding amount. I guess my thought or request is really that, and we should do the same thing with our county contacts, but there are definitely contacts on the commission. We have Senator Rochford on the commission. We have Chief Smith is on that commission. Those are the two that I think of right away, that have close contacts with. I did talk with Attorney Buffetti already, let him know what our needs were, and he's the one that told me about the RFP that they're going to discuss. We just don't know we don't know what the focus will be for that. That's our concern. But we'd really like to have, my ask would be that you would contact folks that you see and know on the commission and let them know that the county is interested in getting some more funding in, because we have no idea. We'll get more funding, but we have no idea what the amount is. We have no idea when it will come. And Julie is following up, trying to see if there's any kind of information on that we can get. And there are a number of county related folks on here, a couple of commissioners from another county. There's a county attorney. There's a former county, what was Jason?
He was a former
DOC superintendent. So there are people on here that we can also contact that may be able to leverage and advocate with for that. So that's kind of where we are right now. I don't know what others have thoughts around that part of.
I think what you said is important and accurate.
Right, and I think we all appreciate
Mhm.
the work you've done and the program. It's a fabulous program, but we literally don't have the dollars in our account even if we wanted to. So, but I think that when we've had other discussions, and we have them almost weekly now because we're getting requests at least weekly now, and we now have to, since we don't know when things are coming and we've spent down a lot of our monies, and some, although they're not obligated, we know what's already coming down the pike. So, but I for one would keep this certainly one of our top priorities if we get significant funding. But even, but we don't, like Commissioner McLeod said, we have no idea when or how much money we will get into our.
And I think the connection with Nicole's program is really critically important. We want to make sure we support that because this, hits on all of our priorities around keeping folks out of the DOC or making sure they're successful when they leave there. That's really one of our top priorities. So this is a really important part of that.
Yeah, I just wanted to add after Commissioner Hedberg's comments. You know, this is a wonderful presentation. And we so appreciate the work that you do, especially in conjunction with alternative sentencing. I'm sorry, because as Commissioner McLeod said, I think, or what was it, Commissioner Hedberg, we just don't have the money. There's a tremendous amount of demands and we just don't have the money. And we are redirecting folks and trying to find out ourselves when more money is going to be available. The state, interestingly, kept, what was it, 85%?
80, they have 80, yeah, maybe it is.
85% of the opioid trust and gave the folks on the ground, meaning local governments and providers, 15%. And so there's been talk, as Commissioner McLeod said, apply for more. But that, to me, I won't say what I was gonna. Sometimes things like that don't happen. And so we didn't get the money. And what we do have, we also have obligated now to our own, some of our own departments. I'm sure Commissioner McLeod told you all of this, and I'm sorry because you came in and it's a marvelous presentation. And I'm sorry that we can't help today.
Well, that was understood
Okay,
before we got here, so
okay,
don't feel too bad about
okay.
it. But in fact, frankly, we had conversations around, do we take this to the state commission or should we go to Grafton County? Or is there an order of things to do? And we have contacts on that commission. I've been at those meetings before. And I know some people on it as well. And so next steps are to raise awareness to the need at the county level.
Right.
And we're happy to help with that effort. No question about it.
Yeah.
Certainly would, it goes without saying, any kind of a letter of support or commitment you need, if there is an RFP that you get involved with, we're happy to be involved with that as well. And again, raise awareness at the state level of the need that can
Absolutely.
be filled today to help
Right.
impact in a positive way.
Yeah.
The opioid use disorder folks who could use it.
Right, yeah, I mean, our way of looking at it, at least it feels like that's the consensus, is keeping the money means we're not saving people's lives.
Mhm.
And getting the money out means that we are saving somebody's life. And why would we want to, just hang on to it? Unfortunately, we just don't have what you all need. We may have some smaller things come in that we'll be able to take care of, maybe or not, but this is a really big countywide initiative that needs, our
Needs to be
support.
supported.
Needs to be
And,
supported.
and I would think that the counties would want to advocate with the state and work in conjunction with the state.
Yeah,
Because it's our investment
Yeah.
in terms of our people, our taxpayers.
right. And we can all assess and maybe talk, after we hear what their discussion is, what their
Yeah,
focus is or whatever. We can perhaps talk about what makes sense, whether the county applies and tries to fill the need of this as well as other things that are coming in, or whether it makes sense for you all to do that directly, with the county support. But we can all sort of assess that and see what makes the most sense
Sure.
when that comes out. But I think we don't want to wait. I think we want to advocate beforehand.
Yeah.
So that, they don't decide to do, I think in the past, they've done a housing program. I'm not sure that we've seen that in Grafton County come, any of that come to fruition. I don't know. But I think we need to, the boots on the ground kind of approach, really.
Great. Yeah, no, we're happy to help.
Yeah.
Thank you so much for giving this serious consideration, and I appreciate your responses to the need and recognizing that it's there and so well, our sleeves are still rolled up.
Yeah.
We're gonna need to work
Yeah,
on
and I
this.
think, your letters of support, I'd be sure to let
Yeah.
them know that we're not turning you down. I don't want people to think that we're doing that. I think we just need to get some money in the coffers for it.
Sure.
Thank you very much
Yeah.
for your support.
And here's the DOC superintendent, right behind you.
These are our friends from North Country Health Consortium. And so we're talking about funding from the opioid fund along with Cole to do assessments for folks and some treatment, services to keep folks out of your.
All in favor, everything?
Thank you very much.
Thank you. Thanks for coming down in this weather too. Appreciate it. And nice to meet you, Rob, and see you, Lauren.
Yes, that's-
And always good to see
Nice to
Bob.
meet you all. Yeah.
Bob and I go back a long time.
Oh, do you?
Yeah.
Yeah.
Okay.
Yes.
High
Yeah.
school.
No, just work,
Yeah.
professional work, yeah.
Thank you very much for having it.
Thank you.
Thank you. This is really useful. Very excellent.
Mhm.
Really,
Really well put together.
yeah.
Wish they were all like that. Set that up.
All right, so when we're running a little late,
Absolutely fine, Commissioner.
we had a little late start this morning, so just a little behind.
Alternative Sentencing Director Nicole Mitchell.
Still here.
I don't have a lot to report on. I think we're working on some exciting things. So North Country Health Consortium is actually the establishment that trained our CHWs and our CRSWs.
No,
So what they're funded to do for education is what provided our staff with the certifications. They are almost all certified. They're studying together to take a test, by the way, super exciting. They're over at the DOC. And as far as I can see, they've done a lot of work very quickly and it boots to the ground, feet to the fire, because they had to do a lot of learning to figure out how to navigate Medicaid, Medicare, and
Yeah, yeah.
housing. And so I think that they're doing fantastic. They are currently we are working on trying to facilitate a recovery gathering locally in this community. So more to come on that. In the early summer, we're going to try to get some recovery focused events going for the recovery community, but also for the greater community to see, there's a huge problem here and in all of the counties. And so we're inviting everybody from other counties, the recovery centers, we're honing in. So that's exciting. And, at the same time, mental health court is inundated. Which is fantastic that they're getting tons of referrals, but we only have 2 staff. The CRSWs have been helping with people who have substance use disorders, going out in the community with those individuals through mental health court. But we're looking at having to waitlist or cap at this point, just because it's just Tom and Shelley, and there's a lot of work being done and it's intensive work. So, in conjunction with this presentation, it's the same as it ever was. We're in the same place. But otherwise things are going really well over there and, but nothing terribly new.
Questions?
no, thank you.
We appreciate all your work.
Yeah,
Thanks. Well, thank you.
and thank you again for coming in with that.
Yeah,
Yeah, of course, Shelley would have been here as well, but she's on vacation, which is well deserved, so also please.
And thank you for all your work with this program and trying to figure out how to collaborate with our local county.
Yeah.
Agencies.
Yeah, no, it's been really a pleasure to work with North Country Health Consortium. They're always very supportive and engaging, so we're glad to do it. And so, it's the same with the DOC, it's good to have those connections, those collaborations, because more people in it, the more helpful we can be.
Well, and more likely you have success when you have all the pieces there. Yeah.
Correct. Okay, have a good day.
thank you.
Thank you. Okay, Superintendent Lethbridge, and I guess we're not so far behind.
We're
now.
catching up a little.
And I don't have a whole lot, so I may help you catch up a little more.
Okay.
You have a lot.
But we're just not opening them, right?
We're not gonna-
Opening them and then I'm carrying them back.
Oh, boy,
You brought your card.
now you've got me
I did
worried.
not, so I'll probably be back.
There.
Oh. The. Report for the month.
Boy, this coffee was. I said I needed that this morning. I feel like I just woke up.
So it was not an exciting month in the DOC, which is always what you want in
Yep.
a jail, so a good month.
I was just saying, it's like healthcare, you never want to be the
Correct.
exciting
Yes,
patient.
our staff's job is to try and make sure nothing happens, and they do a pretty good job of it overall. So our population average was 93, which is a slight reduction. I think we're probably starting to level out, and I think we'll probably be 90 to hundreds is gonna be our average under the current statutes that are covering the criminal justice system. We'll see how it develops, but that seems to be the changes are less significant from month to month now.
Okay.
Um,
Still a lot of work when it's intake and release. I'm just, you know what I mean?
Yeah.
Just,
Yeah.
Take and release is very, and that's one of the big places where the CRSWs that we've got in partnership with Nicole's program. Our intake and release sergeant was trying to cover those duties and do the court
Ah,
appearances
oh.
and make, supervise people being booked out. Relieving him from trying to do that aspect
yeah.
has been a tremendous help for that process. Our food service costs stayed steady. We did, commissioners kindly approved funding
Yep.
for traveling nurses. And we were able to get 2 licensed practical nurses that are currently covering night shift. It has been a tremendous help. Shay has told me, the night shift sergeants were probably the biggest fans of this change because I didn't realize how worried they were every night when they were
yeah,
dealing with new intakes and how bad off were they and not having
Yeah.
a medical professional to
Yeah.
consult on decisions. So they're very grateful as well. Our community corrections program is up to 60 people that they were supervising last month. And we hired nobody, promoted nobody because we're basically full still.
That's good.
But-
Good.
And I cannot complain about that. So our biggest achievement was finally got a request. I was the delaying factor. I finally got a request for proposals published for a consolidated inmate communications program.
Nice.
Oh,
And we had 4 different vendors who have expressed interest. They came and toured the facility. And all 4 of them have submitted proposals to us. We
excellent.
have a scoring document that's been worked out, and I will have volunteers to sit on an evaluating committee for these proposals. We're going to score them and then come back to the commissioners with a recommendation for which company we think provides the best value for our citizens and our inmates. To be upfront, my scoring algorithm weights the value to the consumers higher than what revenue the county might achieve from the contract. And that's with recognition that any revenue that the county achieves is being taken from the people who are using the service. And these are expensive services, and I'm not looking to maximize that.
Well, and you talked before about how necessary these are for the inmates in order
Yes.
to maintain stability and consistency there and all of that, so.
Yeah, I was gonna ask, we've got a good number of folks online. Could you just review that for matters of the public? Why this is an important investment, what the case that you had made to us?
So currently we have a contract with a provider who provides phone services.
Yeah.
The inmates pay for those phone calls, and they pay a relatively high rate because it's a very specialized service. We're going out for a contract that we cover a broader range. It's going to include video visitation, which would allow the inmates to, we can no longer move the inmates up to the front of the facility and put them in a booth for face-to-face visits. People coming to the facility will get on a video monitor and the inmate will remain in their housing unit and conduct their visit. So a lot less movement in the facility. One of the other big advantages is we're a very spread out county, and it can take a long time to get from some of the further reaches of the county to the jail. this system for a relatively affordable fee would allow people to visit from anywhere. And we have inmates who have family who are currently, they'll come from out of state
Right.
and spend a weekend just to visit their loved one once in a week.
Yeah.
Why is the access to more visitation important?
The more we can keep the inmates connected to their family, their friends, and their community, studies have shown forever that that connection helps reduce recidivism. And my number one goal is to make the jail irrelevant. It's never going to happen, but to the extent that we can make the jail not have people in it, that's what we're trying to do. And certainly trying to hold the line on having to build a new one or build an expansion at any time in the future. So we're constantly trying to turn people's lives around and turn them from tax consumers to taxpayers.
Yeah. Thank you.
Does it have any impact on behavior in the facility?
My experience with the one that we installed in my prior facility was, yes, it did. It became another system of occupying the inmates. And because this should be revenue neutral to a small revenue gain for the
Okay.
county. I'm not anticipating paying for these services. The inmates who are using the services will be paying for them. I'd like to keep that as close to the cost of the services as possible.
Mhm.
And so like as an example, the system we have in Florida, I wanted one that had a lot of educational content. The educational content was free. If they wanted to play a game or watch a movie, then they paid for that. But the inmates who didn't have money on their account or didn't want to spend the money on those kind of entertainments, what they had available to them was education. And I'm looking for
It's great.
both recidivism reduction education, like anger management, substance abuse, to vocational things, how to apply for a job, how to do a resume, to just general ed. This should hopefully help support our HiSET program that then be tutoring the inmates will be able to do using the devices that we're looking for in this contract to get themselves ready to take the HiSET test and then get their high.
That's the high school, yeah.
Equivalency.
And just tagging on to that, I assume not only keeping the inmates busy, but it would also help with morale that they might be able to see, even though it's virtual, see someone instead of just being on the phone to reach out to their families or loved ones.
Certainly the ones whose families are unable to come to the jail to do a visit would give them an opportunity to see them face to face.
Support.
And I think of people with children.
Yeah,
that,
oh my God.
You know, be able to
Yeah,
get an
Yeah.
eyeball on your children or grandchildren.
Yeah.
you have to have a nice background and for the kids so they don't see the.
So one of the requirements of the digital masking system, so the only thing that appears is the
Okay.
face.
Yeah.
Great.
You're right, there's a lot of factors that go into these programs.
Yep.
So that is it for the report. Any questions on my report for the moment?
No, thank you.
I do have one action item. It's just it's an inmate transfer. We received a new arrest. The person who was arrested was pretty intimately familiar with the physical plant at the DOC, including security devices and things along those lines. And we requested Coos County accept them as an administrative transfer. And
Did we have, oh, yes, there was one, wasn't there, on the 19th?
Yeah.
Is that the one?
Good
Yeah.
catch.
Okay. I don't even want to know why. they know all this.
Right. 19th? Okay. There, no,
Do we use the
There it is.
inmate's name in the motion or can we avoid that?
Always use the.
Okay, that's what I couldn't remember.
we have traditionally, but
Public record that they've been arrested.
No, that's fine. I just couldn't remember. So
Yeah,
I will
now
make a
see why I
motion to
forgot that name.
approve the
Do you find
transfer.
that?
Oh, I'm sorry.
no.
It was on, I think it was
You
on the
have it up.
19th from Julie.
Yeah, I've got it.
Okay.
Oh, I'm sorry. I thought you said something else.
Do we just need a motion?
I think so. Yeah.
I'll make a motion to approve the transfer of inmate Daryl Dealing to Coas County DOC. And Grafton will be responsible for any medical expenses this inmate may incur.
Second.
All in favor?
I,
Motion passes.
Thank you, Commissioners.
So these, we're just gonna open them and record who we received them from.
Okay.
Then we're going to move them to Superintendent Lethbridge to do his thing with them, so.
They'll come back with a
And I'll come back with
recommendation.
a recommendation, hopefully by next meeting, but I've got it.
That's aggressive.
Well,
I did, I did.
It
I
won't be
did
next
put-
week though, because I don't think,
Right.
we're
we
not
don't meet
meeting next week.
So you got 2 weeks.
Oh, I guess I meant the next.
Oh, you
My
meant
next
your,
regular report
you meant the end of
meeting.
April. I
Oh,
thought you meant
oh,
our
okay.
next meeting.
Yeah.
No. The next one, I'm
Okay.
scheduled to be here.
Okay, so.
And I think that we're scheduled to be at your place that meeting. 'cause
You're right,
that's The
we
end of
are.
April,
Oh.
so.
The end of.
I'm excited
April.
about that.
Wow. Okay.
time flies.
So the first proposal is from ICS Solutions.
ICS.
No, ICS
Communications.
Solutions.
Okay,
This is our current vendor.
That is our current fund provider, yes.
IC Solutions Advanced Technology. The second one is from Smart Communications. Takes me long to get into the other boxes. I did this one.
What's the first one? I see.
so are we putting, is it too complicated to put the,
You're not putting any.
Okay. all right,
So. Oh, you got it.
This one is from ViaPath Technologies. The last one, it looks like it's from Securus Technologies.
put a lot into this, don't they?
These, yeah.
Securus must be who the facilities have.
Securus, is present in a lot of the jails in the state. I think they've got about half of them, maybe,
Yeah.
actually probably more.
But-
Viapath has the state prison in Concord.
Securus is always a big sponsor at the conference.
Securus is the final vowel of E or U?
You,
Okay.
Yeah.
All right, well, we can.
there's
I'll work it out for us.
I guess so.
Just some light reading.
And my target is that my next scheduled meeting with y'all,
why I said that.
Hmm,
And then you had all this stuff, so
Right,
there's not
right,
like
right.
a,
there's no easy way to,
right, we can't really
Record
record, we'll
it.
just report who we received them from and then wait
Mm.
for jail to do the analysis and bring it back to us.
our selection process does allow for, if we don't have a clear front runner, to bring in anywhere from two to all of them to do presentations and actually
Yeah.
demonstrate
Yeah, good.
the technology. So if we go to that, we'll have to schedule with their availability. It may be longer than April before we're ready for recommendation, but certainly I hope no later than May. We'll be ready for recommendation.
Sounds good.
all right, great.
Thank you, Commissioner.
Thank you.
All right, thank you. Thanks for really going forward and doing this work. I know it's a lot of work for you as well.
It was, but I think it's going to help us in so many different ways and help our population.
Yeah,
So
Definitely.
thank you.
Thanks.
Thank you for your help with those, Julie.
Hopefully it's a win-win.
Yeah. Yep. Register Monahan, please come join us. Nice to see you again.
So, in my haste brought, I sent Julie the wrong revenue sheet, so there you go.
Oh, okay.
Alrighty.
So the in comes not in there yet. Okay.
No, they aren't in there yet.
Okay. Is that
Is it just one?
Yes.
Yeah.
And we normally start with revenue.
And here is,
For the people I'm not, Kelly Monahan, registered deed of Grafton County, this is my 16th budget. The interesting thing about our department is we never go on it. There's always either new law or new or new situations that arise that always provide the next challenge, and it's hard to pigeonhole why things are happening unless you know the mechanics behind.
Yeah.
So 2 years ago, the legislation listening to the Bar Association enacted transfer upon death deed, which is a way to somewhat avoid probate, and it names your heir right in the actual deed. So what we're seeing is a lot of activity that doesn't necessarily bring in transfer tax. So we're seeing a lot of that, and we're seeing a lot of estate planning, so it's activity.
Yeah, yeah.
And it's, you know, the whole process, but nothing really attached to it. So, but that doesn't say that we aren't seeing big sales and we aren't seeing normal activity as well. So it's just a mixed bag. Mixed bag. So as Julie said yesterday, we were 103,000 over on revenue to this point. So I project we'll keep seeing this, you know, Lebanon's having a big forum, in today's paper. They heard, they wanted to hear from their planning board on housing, how many units are in process. I've personally assigned myself to Orford Planning Board for the next 3 years. I don't know why, but I did run and I'll do that because all of our towns are tackling this, you know?
Yeah.
With growth and with big pockets from out of state owning. So, anyway, that's the revenue projections, increases.
And so you've had some significant areas. I don't know if it's helpful for folks. Do you want to hear specifically about any of those, or is the overall?
Well, it looks like I'm projecting, what, $150,000 more than last year. So 1,336,000 is what we're looking at.
It's
fine to me.
And it sounds like even with that transfer upon death, that's a lot of work for you, but no revenue, we're still seeing a significant increase in the transfer tax and recording tax revenues.
Yeah, so, well, that is, you know, those estate plannings and transfer fund death, that type of thing. It's recording fees, you know, but the transfer tax, like, you know, we had the Staples sale. I don't really love what Littleton's doing with the Staples, but it's my prejudice against gambling. When I went by Foxwoods as a kid, it was bingo hall on the cornfield, okay? It wasn't Gamble City, and I saw what happened to that whole area.
And I think that was because that was before the law, the current law or something that they can.
Oh, no, they were gambling, but it was a bingo hall. They were reaping the profits.
No, I was thinking the whole Staples thing that Littleton
Oh, yeah.
just voted
New Hampshire's
against
gone
that.
now. Susan Almy fought it for a long time.
Yeah,
New Hampshire's gonna gamble now. Happy with it.
but the town did vote against it. from
They
what I
did.
understood.
Well,
But
that doesn't
the
mean
gentleman
our
had
time.
already applied before the law was changed. I think that was the explanation. Yeah.
Well, I hope we don't see too much of it.
So,
I'm living proof what I saw happening in Connecticut, you know?
Pay for the services that you want. Don't rely on those sorts of funding streams.
You know, it turned to people moving kids in cars, commuter
Yeah.
parking lots, prostitution in the parking lots, total degradation of the neighborhoods. It was horrible.
Sure, of course.
And let's talk about law enforcement, you know, what happens to law enforcement.
yeah, it's a lot for a small town. to
If
take
there
on.
is, if you're attracting, in my opinion, wrong element, but anyway. So the only other really big significant change, luckily, you know, Scott's been a blessing to come on board, I really believe. I'm feeling so much more secure. You know, I had to separate my technology and reliance from the county years and years ago when I first came, and it was always a concern for me overall. And so I'm really happy where we are with Fiddler with the Bastion product, but I'm happy here too with how things are going with Scott overseeing things.
Yes, great.
So he took on my the 4,800 for our internet as he's consolidating a lot of departments' expenses. So that was a decrease on that line. And just, it's been, you approved the waiver, I believe it was in November, October, for the Fiddler contract renewal, which, July first will begin our renewal of a 5-year contract with Fiddler, which brings a great deal of stability, a great deal of peace of mind for the staff, because conversions are a nightmare.
Yeah.
Carroll, County had a register who we never saw eye to eye. She came from the abstract community, and everything was focused on making things easier for the title abstractor, and that's not my focus at all. We will default to review doc a lot, which means read the document and decide for yourself. And so Carroll County has a new register, and she convinced the commissioners and delegation that they took a bad turn, cost them a lot of money, but they're back. So now the 9 counties in the state are with Fiddler, and 2 just followed my lead and went with Bastion for secure of the database. Over 6 million digitized images, all the way back to 1774 in that database.
Oh.
With a lot, with good secure backup as well. And I do send the test, I got another one to send to Scott. When they'll run a drill out there and do an emergency test, they do an all hands on deck, like YouTube of it, and they sit down with the corporate and discuss the next challenge. So I do send those to Scott so he can see what he's dealing with out there. And we just had a visit from more regionalized. We've had, luckily, when we went to Connor Sale and went with Fiddler years ago, before me, they kept New Hampshire employees that were with Connor. And that is our greatest relief, because you have to imagine, you can't just, it's not like in modern day where you just upload it and internet savvy. You have to take something that was designed in 1700s and make that internet savvy, make that ability. So everything is done differently. We've only got 12 document types. At one point, when COAS went with Fiddler, they had hundreds and hundreds of document types because they named the document the title of the deed. So it was Joe Smith's deed. That was a document type. So a lot of cleanup behind the scenes.
Wow.
And the bigger they are, the harder they fall. And I guess I'll leave it there with that one. Sometimes there's more fluidity and flexibility when you're smaller and in the woods to make changes and to clean things up than the big giants. So anyway, that's the only big change. And like I said, we've not had an increase in software in, I want to say, 2 contracts.
Yeah.
So it's a modest one that's coming, and I did increase that line $20,000 to 120. And if we go over, get scraped to the general fund. So other than that, and everything else is pretty much level. So figuring out what's going on with microfilm. That's it's a new program, so we're seeing they do it so to get to it. So sometimes I'll get 2 or 3 months at a time, or sometimes I'll get 6 months at a time. So it's hard to see because it's got to be volume of documents mixed in with the months. So I'm winging it on that. We'll see where that ends up when they produce, because it's months later from the actual that they produce the microfilm. And we store 1 copy here, and 1 is in a New Hampshire-based secure facility that is owned by a municipality.
I do believe I signed those invoices.
Okay. Inside the knowledge. And it's a really cool situation what that town did with an older building. I've been down there, and they do charge for an intake, so that's why I bundle. I have a big metal safe in my office, and they hold in there until I get ready to make the trip, which will be coming up. Any other questions on anything?
Not a question, but I think I'll just comment if it comes up, some of the other increases such as health insurances because of the new employee. I just wanted people to.
Well, the thing with mine is I'm still deciding on what to do with the new employee. 2 of my staff have just received promotions, as you know. They've done a lot of intensive training, and but every day is a new challenge right now. And I should put this on your radar. This is going to open up can of worms in the state. We've had to put to DRA the question of transfer tax on carbon rights.
Oh.
And it's illegal with DRA. Do you know the storm? That's wow.
So is that, I understand that from the COAS perspective. How's that impacting what's going on here?
Oh, you have to here.
Oh, we do?
Yeah.
Oh, I didn't know that.
They're all one entity, LLC'd in Concord,
Oh.
and another county got one the other day, and so now we've thrown it back to the IRS. Okay,
Wow.
they're getting payments.
Yeah.
So it's been with legal for 3 weeks now, so we'll see where that ends up. Is that a game changer?
Here's one silly, perhaps a silly question. Office supplies.
Okay, yes, we visit this every year.
Yeah.
You do buy a big paper bulk, and you do everything late. And a lot of the things, so even the postage meter gets reset in June.
Oh, okay.
So a lot piles in at the last minute on that spot.
And you also sent us something, oh, may I?
Yeah.
On surcharge, but I think it was an old document because it has 24 and 25.
Oh. Well, I just picked the whole wrong file on Friday, didn't I?
It doesn't matter, it's the
It
same.
doesn't
It's the same, I was gonna say, and that would be my question, is it looked like it
Yeah,
had been
it's
saved.
exactly the same.
So,
Yeah, don't ask me during the Friday afternoon, especially when Fred is not.
I just wanted to make,
Long enough to Julie.
I just wanted to make sure I wasn't
Yeah.
missing something.
I'll get you the updated one, but it's exactly the same.
Perfect, no,
You
no
don't need to
worries.
send a new
Okay.
one.
You don't
I'll
need to,
put it
that's
in the
fine.
master one and. Be fine.
That'll be great, thank you.
Thank you very much.
Thank you very
Nice
much.
job. Have a good day.
Thank you.
All right, Mr. Oaks, fuel bids.
This sounds like it's been a really fun
hear
time for you, Mr. Oaks.
Wow.
Everybody has copies.
Yes, thank you.
Don't all have copies of what do we have?
Jim's budget.
Oh, so we do have that.
budget.
Yeah, you
Oh,
gave it to us
I'm on
yesterday.
fuel bid.
Okay.
I gave you hard copies yesterday.
Yeah, you did.
I'll bring them back.
Right
today.
here,
Yes.
yeah, I never took it
Somebody-
home.
We also have, oh my goodness, a bid for fuel.
Let's see what happened.
You don't wanna know what happened.
Oh, dear.
They're gonna have to allow you to take today's, this is good yesterday,
Oh, no.
and it's 25 cents more a gallon than it was last week.
Why are we getting another one?
Because when they sent him the contract, they sent him a different price and you all had approved the price that you had approved and we don't have any authority to sign a contract for a different dollar amount.
I think what they're doing this year, because things are so volatile, they will not lock in the price till you actually have signed a contract. In years past, we can tell them, we want a price that's good till noon on the day that we open the bid. And they haven't been, and they've been fine in years past, but until that thing's signed, it's a moving target.
I read that last night and well, I was quite surprised, let's say.
So this, it was 3.6 something, right?
3.60.
Yeah. So, and this is on the 23rd.
Yeah, so it'll be a new price today.
So
I'll
I
call
got
them.
to call, find out verbally what it's, what it's gonna be, and then come back and tell you, and if
Either that
you
or you
agree to
can-
that, then they're gonna have to immediately send you paperwork I gotta sign that same day. And that's assuming I get a hold of whoever I need to get a hold of.
Yeah. And this is just, it says Grafton County Farm. Was that what the other one was for as well?
That's for the complex, right?
And it's the farm.
Oh,
that I'm
farms,
using
they're
it,
meaning
so
the
My department
complex.
uses it as well.
Okay.
It's,
I just want to make sure it wasn't just one place we were paying one and then the other. So what do you want us to do? with this?
Can you read it?
Yeah, so this is a bid from Dead River for a 26-27 off-road diesel fixed price quote, and it's 3.8543.
We're all pretty stuck, aren't we?
Need you to reject the bid we did last week too, because it's no good anymore, so we need to reject that, and you need to vote on that, and then. What I would say is you want to lock into a contract with Dead River, you accept. Or you authorize Jim to accept the price that they give him today, and. Cause it's probably gonna be a different price, it was 5 cents more from Monday to Tuesday last week.
Actually, didn't things go better this?
But prices have still gone up.
Over $1 in the last month.
Okay.
So I will make a motion to revoke the bid, the approval of the bid we made last week for the 3.6. I don't remember the 042, and accept the bid. For three,
You can't really accept the
Yeah.
dollar amount.
and accept the bid from Dead River, giving Mr. Oaks permission to sign a contract at the amount they give him today. Is that what?
Well, what it is you want me to go ahead and verbally talk to them, come
No,
back to the
I don't
board.
want them, what if they're not here when you get back? Or you don't hear back from them? They just give you the authority to accept the bid. Then, we don't have to,
Because otherwise we're gonna keep doing this.
Right, it's
Right.
every day it's gonna be different.
We need to just lock it in and sign it.
I mean, if you wanna go
And
call
if
them
you,
right now,
using
you
your,
can get a price or somebody to talk to.
and tell them to send it over, we'll be here.
Typically, there have been times they've just verbally told me,
Mhm.
and then I get back to them right afterwards and they'd send the they would send something over with a contract that I would immediately sign. So if you don't mind waiting for a few minutes, I'll go call her.
Okay.
We can
Oh,
do
I'm
the other
sorry.
agenda stuff.
Yep.
Well, just, right.
So we'll just hold off and we'll do the other. Gotcha.
All right, let's see. At the minutes from 3:17,
I didn't find any, I don't have any corrections.
I don't either.
I actually had a couple of things. There was just a word was missing and others in attendance. Just said alternative director and it should be alternative sentencing director. The other thing is, when there was a discussion under the dues portion in the alternative sentencing, there's an acronym, that was written in it a few different ways, because Nicole had it a couple of different ways in her, budget. And so Sam and I just figured out which was the correct one. So it's the NAADAC, but she had it several different ways when it was typed. So I just fixed those two things.
Motion to approve the minutes as amended.
Second.
All in favor?
Aye.
Motion passes. We have check registers, just a few today.
The legislature. Casino. Legislature approved. Casino.
That the towns have to, they have to actually vote they have to opt out.
Ah,
Towns have to opt out, so.
Oh, so for the gambling, it's an opt-out
That's
and not
right,
an
yeah.
opt-in.
Yeah, we can thank you legislators for that. So towns have to fight it off if they don't want it.
so this was, so the legislature approved, what did we used to call it when I was in there? Destination gambling, I mean, a big facility.
I
approved.
don't really know what type of casino, it was. I'd have to go-
Because we have small ones around, but this sounds,
Yeah,
what a
sounds more
shame.
serious. But I think I read it in the Caledonian or the
Okay.
Union Leader. I can't remember where I read that this
Hmm.
person either applied for a license or purchased the property for this purpose or whatever before Littleton opted out. So it made it sound like that they would be able to move forward, because that was my question is, wait, why is he buying this for this
Yeah, yeah.
purpose if the town said we're opting out?
Mhm.
So I'm sure they're all looking into that.
My goodness.
So
Because
I'm
I know
certainly
that-
not an expert, that's all, I just remember reading that.
And I don't know what's happening, but I know Ashland was looking in, or someone had expressed some interest to have a casino in Ashland near where the
Yeah, I remember
golf
that.
course is, so I don't know what's happening with that, so.
Wow.
I just think it's a lot for a small town.
I
Yeah.
think it's huge for the small town.
Well, I'm with Register Monahan on this. I don't think that it's a
Eh.
good thing for our state.
And maybe a little unfair. I mean, the whole local control things,
Yeah.
people think that's in New Hampshire when it's really not.
Well, it's getting less and less with what's being voted on.
Right.
Restroom.
Okay. Yeah, we're gonna take a break for a moment.
All right.
I can look up it. What's it? Dead River? And Jim, you got some?
Yeah, I spoke to Karen Westover, the one who picked the bids, and she said they'll on the bid as it's written.
Nice. Okay. Sort of.
All right, so I will make a motion to revoke the bid for the 3.6042 that we made last week. And accept the Dead River bid today for 3.8543 for the off-road diesel fixed price.
Second.
All in favor?
Aye.
Motion passes.
Everybody just have the budget.
And so we're going, just to be clear, she's gonna send paperwork over and,
She's sending it to me right now, via email, contact. I'm done here. I'm gonna-
thank you.
So as far as the budget goes, you should have a Word document summary page, and
Mhm.
spreadsheet with everything. I'll go off the summary page and just, if there's something that you want to further explanation, just stop in. Dive as deep as we need to. Just a caveat, obviously with the price of the fuel being kind of a moving target, obviously these numbers are change a little bit, not much, but. So we're looking at roughly, a 7% increase for the department. It's about, is it right now, $228.96. $964 more than last year. Starting out with wages and benefits, across the board, reflects the cost of living adjustment increases, merit increases where they're merited. In regard to account that ends with 002, the electrician grade, I'd like to change that from a G13 to a G14. And this is based or predicated on HR reviewing and recommending this. We've been using the heck out of the master electrician, and it's more commensurate with the wages others are earning outside the complex.
Okay.
Right now, the current electrician is a G13, grade 15, step 11. And we move up to grade 14, step 10, which is only 70 cents more per hour, but that would happen effective July 1st. I just wanted you to be aware of that in there, and it's
Thanks.
transparent.
Question. Question, Jim.
Sure.
So I'm used to them being called step increases. And so their merit increases. So just two questions. Are the merit increases the step increases? And when you say for some, is that because there are folks that are earning actual merit increases? Or is it because there are folks that are automatically going to the next step?
No, the merit increases are based on evaluations that they get.
That's
So-
step increase, right?
But yeah, it's
But
part of the merit. The merit is the overall program. Each person is assigned to a grade, and within that
Yep.
grade, there are 12 steps.
Yep.
And so they typically stay within that grade for whatever they've hired onto.
Yeah.
And in this particular one, we're trying to change the whole umbrella of the grade, moving from one grade to the next. And then
Okay,
he'll have, depending on where he lands, there are 12 steps within that grade. So just that transition it's a minor raise initially, and I think his annual is due in December. That's his anniversary, where he would get his merit, or he'd get his evaluation, and if he has a good evaluation, he'd get that step increase.
okay. Just a follow-up. So just to make sure I'm understanding this well, so we've discussed this for a very long time, and that is that the step increases, yeah, you're right, that it's a performance evaluation. But I remember being told many years ago that 95% of county resident, I'm sorry, county employees get that. So that's 95% have a performance evaluation that allows for a step increase. So some people in the delegation, in both parties for a long time, have worried that that's not really a merit increase. It's kind of automatic. So that's the long-standing discussion. And so what I'm asking you, please, is to just, so the merit increases, are you saying this year that there were performance evaluations that did not warrant someone getting a step increase or a merit increase? Or is this just working within the merit increases for some, working within the existing step system
If you're
and
looking
grade?
if you're looking at all the wages and benefits, when we're talking salaries, what is it, code 001 through 005?
Yeah,
There would be a small population that wouldn't merit one and they wouldn't get anything, or there are people that are maxed out in grade that wouldn't get anything. So that's why it's like, for instance, when we talk about account number 4, you'll notice that it's a decrease of almost 7%. And that would affect the question, why aren't they getting one? Well, they are. It's just I've got newer employees that came on at a lower rate. And so even though they've got this, it's planned that they would get a merit increase, they're paying a lower salary, that reflects the decrease. That's answer your question.
sort of, but so I understand. So, right, so not everybody gets a step increase.
It's not guaranteed.
And okay, and so I know that one way that it's not guaranteed is that somebody steps out, right?
Right,
That's
so
one way that it's not, but you're saying that this year, even if somebody has not stepped out, they might not get that step increase based on their performance evaluation. Is that right?
what we do is we budget as if they're gonna do well. We hope people do well. But if they don't, they won't get it.
Okay,
Okay.
thank you.
So, I mean, the majority, like I said, is either cost of living increases or where merit increases are warranted or earned. And there is the capacity to move a step, it's budgeted for.
Okay, thank you.
We did have a moving down to wages in lieu of health insurance, account 010. I'm just gonna read the last 2 digits of each one as we go
Yep.
through. We added 1 new employee, so that's why that's up.
Yeah.
Health insurance, you're well aware of increased premiums. Moving down to education conferences, 170. What I intend to do is encumber about 2,000 from current year funds. Which will offset this budget, which is giving such a large reduction. Moving down to contract services. In the 290 account, hydrant fees increased. This year, we're planning to do storm drain cleaning. We do it every other year. So it's coming up in FY 27, and that's usually about a $4,000 cost to do that. And then there is a increase in Hampshire DES emissions fees. So that accounts for increases in 290. At the nursing home, 291, we're looking at a 66% price increase on trash and recycling. Also, what you're looking at is I've got a significant generator repair. I think I told you about the last time we met. And that's gonna get spread between the nursing home and the biomass because it's a shared asset. The nursing home gets the bulk of the charge, about 75% of that. So it's a significant cost. I think I told you that the temporary generator that's gotta be brought in and set up, cover that, or bridge that period while ours is down is part of that. We're looking at some rate increases on underground storage tank inspections. As well as testing, ozone preventive maintenance, and then elevator and sprinkler inspection and test contracts are as well. At the courthouse, it's predominantly scrap and recycling increase. At the admin building, same thing, all the buildings, the same thing.
Yeah.
And a lot of the same things as far as like rate increases on underground storage tanks, elevators. Stuff. And for Department of Corrections, we got a couple here that are pretty significant. The sprinkler system 5-year internal pipe inspection, it's mandated by I want to say NFPA, either 13 or 0.5, but anyway, it's a required inspection that we've got to do. And then lastly, we're looking at a 5-year renewal of the JACE, basically part of the building automation system, which as far as software agreements for like software patches and updates, for managing all of the building automation systems that basically control the heat and all that stuff. Moving to page 2 of the summary. The biomass plant, that's again 25% of that generator repair. And then we do have a 5-year internal pipe inspection that's due, as well as the renewal of the JACE software maintenance agreement there as well. Moving down to the electricity account, 619 through 628. In January, Woodsville Water and Light Department said, Superintendent Kevin Shelton said the supply contract for the electricity renew is in the 4th quarter of this year. He said roughly around November timeframe. And he said, I cannot anticipate at this time where the pricing will be, as that process has not yet begun. And, basically not sure on the rates. He says, we're investing over $1 million in the system, including substation upgrade, step down transformers to convert 2 remaining circuits. So right now it's, I'm doing the best guess I can do, looking into the crystal ball and throwing out 15%. It's, hopefully it's enough. I don't know.
I'm sorry,
No,
did
go
you hear?
ahead.
Yeah. Just a quick comment, and especially for members of the public that are attending. So it looks to me like at least through page 3, the increases that we're seeing are due to providers that the price of services. Yeah, we're not paying for supplies here. It's the price of services. It's, that is going up. I think that's the marker in the world right now.
Yeah, it's predominantly fuel and utilities and
Yeah.
obviously, we can't go to the gas pump and haggle the price or go to the utilities and haggle our electric bills, to get them down. They are what they are. And so what we can control though are energy efficiencies and the way we use those
Yeah.
things and try to do that.
And the people who provide services to us, like I know that the the trash disposal went up, and that's very unfortunate, but the people who provide services to us are also absorbing those. I mean,
Mhm.
everyone is paying the increased, whether it's inflation or the tariff or now something else that's going on, it's just trickling down, right? That's what I'm trying to say.
And I have a question. In addition to what we know are the current world volatility of prices, the 12,000 kilowatt increase at the courthouse you have, what would and that's increased usage?
It's increased usage. I can't dogmatically tell you that it's this. It's a big building, it uses a lot.
Yeah.
Last summer, seems like it was a hot year, and what we do is can't tell you what the weather's gonna be like next year, whether we're gonna have long summers or short winters or whatever, but basically what we do is we always typically go back and look at the previous
Yeah.
year, or maybe even 2 years worth of data. And that's what we have to go on, and so when I see, looking at last year's usage, I can see that it went up.
Sure.
And so that's really what it's
Yeah.
predicated on.
And I guess the same for the DOC. I know that for water and we have an increase because there's an increased census. Would that also account for the increased kilowatt hour usage at the DOC?
Well, this is the demand usage. There's a difference between kilowatt hours used versus kilowatt demand. Demand is basically, am I turning on, one piece of equipment, or am I turning on several pieces of like equipment at the same time? And when I do that, I have a huge demand. It's, hey, I need this power right now. Okay, so when I get the electric bill, it comes in two pieces. It'll say,
Yep.
okay, you use this many kilowatts in this facility over this span of time. But during this span of time, you had a period of demand where it was this level, and this is what we charge for that month based on that demand level. And so what I'm telling you is we had over last year, looking at all the demand data, our demand went up. We had, could have been because of a long hot summer or whatever, but not knowing what next year brings, we're just trying to
Yep.
budget just in
Yep.
case, and so that's where you see those increases below.
Okay.
But as you can see, I budgeted a 15% increase. It's not
Yeah.
Yep.
based on anything concrete that you can hang your hat on, because it is kind of a moving target. They don't even know where it's going. Okay, and so we do know that whatever cost increases are will come in November once they sign that new contract.
Mhm.
And then we do know about these increases in kilowatt hour usage at the courthouse as well as demand.
Yeah. Okay, great. Thank you.
Moving down to the water, in that same conversation, Kevin said you would anticipate a 10% increase for water rates. They're looking at some state mandated expenditures at the water treatment plant that are being planned to include a service line inventory work, water treatment lab, equipment, and the probability of adding some UV light disinfection treatment at the water treatment plant. In addition to this, our meter fees have increased anywhere from 4 to 10%, depending on the meter size. And then whatever changes become effective January 7th. So right now, we'll go the first 6 months based on existing rates, and then January 2027 is when the rates will go. In addition to that data, at the nursing home, we had a marginal increase in usage water. And at the Department of Corrections, it is fairly significant, 300,000 gallons increase over the year. And we do know the population is going up there.
Yep, yep,
Yeah.
yep.
So
absolutely.
that's what we're attributing.
Yep.
Obviously, whatever happens with the water is gonna have a domino effect with sewage rates, because typically whatever comes in goes out. I just had a recent conversation with Kevin Shelton, and if you recall, I think it was either in the last or the previous meeting, we talked about the potential of, well, they were going out for a bond vote.
Yeah.
For a $6.5 million upgrade to their sewer treatment plant. And that was held on March 17th, and it was approved. So, initially, we were looking at 15%, but now he's saying it's gonna be a 22% increase. And that's to help cover the rising operational costs, as well as starting to defray the cost of that project, that $6.5 million project. These rates become effective January of 2027. And then lastly, there were some changes within the facility. Once again, the nursing home, the water went up 8,000, the sewer went up 8,000. DOC, the 300,000. The farm is kind of a moving target, and it's really been difficult to pin down the sewage of the building, because what happens is when we take a sewer reading, or the Woodsville Water and Light does, we have a central meter that reads the entire complex. Okay? And then it does not give an individual breakdown on buildings. So what I have to do is I got to go back and I got to look at each building. I mean, what did it use each month for water? So buildings like the Department of Corrections and the nursing home, the courthouse, it's assumed whatever came in went out. Really, once you get to like the barn, if there's anything left over, it gets applied. And usually it's something less than what they took in, because the cows are consuming a lot of water, and what they discharge is typically not going into
Sorry, yeah.
the metered sewer. So anyway, it's been a challenge to come up with a solid number. But anyway, based on last year or the last couple of years, we're looking at about 210,000 gallon increase. So that's what you see there. Moving to page 3, fuel counts. Wood chip stayed the same. We're locking the contract in the end of this year for that. Propane, same thing. The diesel, obviously, we knew going into this, we didn't know what it's gonna be, but there'll be a minor change based on. We're not talking a lot of fuel, you know, when you compare it to like a propane account or whatever. Propane, you're looking at like 35,000 gallons, whereas the diesel's like a little over 5,000. I think so there'll be a minor change there. As far as changes in use, starting out in the nursing home, all of them down through, we're reducing the heating oil. And the reason being is we added, whatever you see added here as far as gallons and being reduced is what was added in the current budget. We haven't used it yet, but we're gonna top off the tanks in June. And they'll be pretty much at full capacity, and I don't anticipate, barring any sort of major catastrophe with the biomass plant, where the, you know, it would be down for months. I don't see us needing any heating oil. So that's why you see that reduction across the board.
Nice.
Now, in the nursing home, we've seen a 4,000 gallon increase this past year, so, and I, attribute that to the population increase. You're using a lot more water or fuel in the laundry to heat water, and the kitchen, the dishes, and so on and so forth. Moving down to the admin building, you see the reduction. Courthouse, the increase is 50 gallons, which is pretty marginal. The alternative sentencing is a couple hundred gallons of propane increase. The maintenance farm building, it's about a 300 gallon increase. And then the Department of Corrections, this is for that diesel generator, about a 750 gallon increase. Moving down to vehicles. We've got quite a bit of money still left in this account. And so, and I don't, barring anything major.
Nice.
I anticipate being able to encumber roughly 5,000. Reduce that. Next time a year. Moving down to the repair and maintenance accounts 805 through 838. In the care of the grounds, we want to add some bollards. I don't know if you know what bollards are. They protect hydrants and critical infrastructure from vehicle impacts. One of the guys pointed out one day, he said, I'm surprised nobody's ever hit that hydrant out front of the admin building because there's no bollards around it. It's like, you're right. So we're gonna go ahead and do that.
We hit the building instead.
Oh, yeah. Exactly. We want to refurbish the footbridge to
Not
the
anymore,
gazebo
we'll
because
fix
it's. Refurbish the footbridge to the gazebo because it's getting pretty tired and it needs some repairs. And then we have a couple of generator sheds or switchgear sheds out between the barns. The doors are pretty rusted, so the doors and the frames need to be replaced on those. Moving down to the farm, the 810 account. We need to rewire all the pulsator system throughout that main barn. I think I reported it to you the last time we met. And we also want to replace, that's part of the milking system.
Oh, okay.
Hooks to like the apparatus that hooks to the outer ring. Pulsates to get the milk out. And then we also want to basically reside the entire south side of the south barn, which faces the nursing home parking lot. It's getting pretty bad, and so we want to side it and paint it. Moving to the alternative sentencing building, we need to add some snow rails to better protect the generator and the AC condensing units. In the nursing home, it seems like we've had a proliferation of bed and tub repairs in the past year, so, we increased some numbers there. We've got about 15 windows that are fogged that need to be replaced. We're seeing issues with our air handlers where the heat coils, they've been patched and really are at a point being where they can't be patched anymore, so we have to go out and replace them, and they come out about roughly close to $2,000 a pop. Now, I've got this caveat where we can reduce this budget by $1,000 if the nursing home replaces the dish machine, which Craig is carrying in his capital reserve. So. In the admin building, the big thing is 18 windows that have to be replaced. You're probably very aware of the structure insurances, the amounts increasing on average about 34%. Once again, it's one of those things that's kind of out of our control.
Mhm.
And then lastly, for the new equipment and small tools, for the new equipment 970, they're looking to purchase a hydro seeder for restoring the grounds in the springtime. There's always a lot of plow damage, and that'll allow us to get things looking nicer sooner.
What'd you call it?
A hydro seeder. Have you ever seen projects where they spray like this green, like
Yeah.
matter with some sort of fibrous materials and stuff in it?
Yeah.
It clings to the ground really well versus just broadcasting seed and trying to put hay down on it, which blows away. And
Okay.
anyway,
That's what that
it's
is.
Much more successful in establishing grass and areas like that. So
Okay.
that's the big ticket item. A smaller scale, they're looking for a sheetrock dust collection tool that goes with the vacuuming system they have to, keep the dust down in areas where they work. And then the custodians have asked for a dedicated floor stripping vacuum, as well as wanting to replace a couple of carpet vacuums that are pretty tired. So, and then this small tools and miscellaneous, we're looking at, increased cost for office supplies, personal protective equipment, and then some water test kit. So that's the main budget. I don't know if you have any specific questions that I haven't touched, or maybe I've touched that you want elaboration on.
Just your
This is all
usual.
my backup, because this is where it all goes, and then it gets fed to this. So if you want detail, I've got it.
more detail. You give us a lot of detail.
We
Yeah, but this is Jim's full budget here, so. You just get the summary.
We get the
part.
highlights.
Yeah,
So what's this, the allocations?
that's just shows us how we allocate, and we only allocate to the nursing home, not just to the breakdown
Okay.
we've had forever. All the
Okay,
For many years, though, we would allocate back to all the departments,
Yeah.
and because I think it has to do with reimbursement at the nursing home, kept it in place. So, Dawn in finance usually is looking for numbers from me, and that allocation is, I'll do that.
well, that's helpful, actually. Yeah.
Asking a question there, we can move to the capital outlay. And one of those requests, once again, is predicated on this standard that we talked about before, but we didn't have a copy of this. Thanks. They have something fresh in your hand.
The capital outlay budget is probably in your book, because that was originally sent, that was originally given to Santa, but that didn't change.
It seems like no matter what,
So we
Yeah.
should take out what's in the book of these other pages?
Yeah,
So just,
Sam will take care of that for you on it.
Sam?
But the capital outlays in there, so we'll have to look for that. Could be a good pen.
and I assume it looks like this.
Yep. That is the page you're looking for.
Okay.
so if everybody's ready. Starting at the top. For this building here, we have an underground storage tank that needs a sump repair. I reported to you that we caught the edge of the sump with a plow this past winter. It needed to be replaced no matter what, but now it's immediate. We gotta wait till the weather warms up because there's some concrete work involved, but basically, the cover and the sleeve that goes into the mortar needs to be replaced. And so anyway, Lakes Region Environmental has given me a cost of $7,645. That does include a 10% contingency. In fact, all the requests include a 10% contingency.
So this is something you can wait until July to do?
We can. Right now, everything's coned off to keep people out of there.
Okay.
So it's, yeah, we can survive till then. Moving down, this is the one I gave you, the ASHRAE equipment life expectancy chart. The request is based on, this chart and its recommendations. Basically, a lot of the heating, ventilation, and air conditioning and refrigeration equipment in the complex is very old. In many cases, the equipment is either at end of life or exceeded end of life. It's not to say that it's inoperable because we've maintained what's here. But it's time to start thinking about its replacement, okay, in a staged or planned way. So in the nursing home and this building in particular, it's going to be challenging because some of this equipment resides in the attics of the buildings. And then, it's very large equipment and, logistically, how do you get the old out and get new in? Okay, so really, what I did is I reached out to a company called Du Bois and King Engineering. We used them for a sewer line replacement project, and they were, in my mind, over the years of working with different engineers, they were one of the best that I've worked with. And so I told them what it is we wanted. We wanted them to provide a specification for the existing equipment and, a replacement, it's modern. And then help us figure out logistically, how we're gonna get this stuff out and how we're gonna get the new in. And put together a scope of work, cost estimate, and it's predominantly focused on these two buildings. And it's not something that I would want to try to plan in-house myself, because there's so many moving pieces and parts here. It's gonna be challenging with an occupied building doing this. So the total cost for just the engineering is gonna be $47,650. Bulk of it will be carried by the nursing home in their capital reserve, because the bigger of the two buildings is that building. Proportion would be $29,630, and then for this building it would be $18,020. Like I said, that includes a 10% contingency. And all this does is provide an engineering document that lays out, like I said, you know, a plan of work. What has to go in there, how to do it, it'd be something we hand off to. Well, it'd probably have to be fine tuned to actually contract this stuff out, but it's right now for a budgetary standpoint, and then. You know, to identify every aspect of this job. We really need this document. So anyway, that's what that is. Moving down, the next two go hand in hand. The last couple of years, we have not sealed a lot of the asphalt cracks, and the longer they go, you get into this time of year, that freeze thaw, and the deeper it goes, it starts to ruin the base, and when you ruin the base, you have to do what we did at the nursing home. You gotta pull up the whole parking lot and pay exponentially more as replace the base and all that. So this is supposed to prevent that. So the asphalt crack sealing and restriping and all that, campus wide, that's what you're looking at as far as costs.
We're all driving on it right now.
With that,
I said we're all driving on this problem right now.
Yeah.
Frost heaves are,
well, we have some areas that are worse than others. Yeah, the nursing home is probably the least of our problems, because, you know, it was recently repaved years ago. It's holding up well.
no, can really destroy the parking lots
Oh,
too.
it's, yeah.
It destroys the road. Anybody else on going 116? Been here in Benton.
Yes, the other day.
Frosties.
Well, it's just like somebody's, like they tried to fix it or something.
Oh.
I don't know what they made it worse.
Well, if you want a real nice ride Pangamangus from, you know, the campground here, Twin River, all the way over to Lincoln.
Yeah,
They'll rattle your teeth probably the first 10 or 15 miles. I mean, like,
Wow,
It's-
Holly
it's
does it every
horrible.
day.
yeah.
you don't have that every day? No, you do.
I always say I'm a milkshake by the time you get here.
Yeah, last stretch, you coming this way is terrible.
Yeah.
I've seen where the road is actually done this.
Yeah. Yeah.
All the way across, and it's like hitting a ledge.
Yeah, and they just redid that piece of it too, coming up from the Eastern Road up, you know, that steep hill. They just redid that last summer and it's breaking apart, just like you said there.
So New Hampshire seems to think that just putting a layer of, asphalt, and it's lovely for August
2 months.
through November.
Yeah.
Yeah. And then there's a spot between, just at the north side of Warren, that they must have had some leftover asphalt, because it just seemed to be put down, but it wasn't smooth with the rest of
Yeah.
the road.
That's what I'm talking about on 162.
And this was,
Benton to here.
but this was done with with all the paving they did all summer.
Yeah.
And all of a sudden they ended up, they must have had a little extra and they just
Through it.
put it down.
Anyways, we appreciate
Yes.
that.
Wow. We appreciate.
Nice job, Jim.
the
Thank you.
Detail of your
Yeah,
budget. Helps
absolutely.
us think through things.
Okay.
This is really interesting too.
Yeah.
Yeah,
Good information.
Well, it's not like Jim says.
Yeah.
This is what the
Yeah.
industry says,
Yeah.
you know?
Wish I had this yesterday at our meeting.
Yes.
We heard comments and things. Looking at even the boilers, like, oh,
I mean, nothing on this list says their lifespan is 50 years.
No, but your boilers, your cast iron boilers typically have probably the longest lifespan. of
Yeah,
any piece
yeah,
of equipment.
yeah.
24 to 30 years for
And
boilers.
ours are not being targeted for that. You know, in this thing, it's more
Right.
HVAC and in the nursing home, with refrigeration as well.
Yeah.
Or I should say, more cooling and heating as far as air handlers and condensing units and all that stuff.
Yeah.
No other questions?
Thank you.
Thank you very much.
No, it's excellent. Patient. Appreciate that. All right, Julie. How are you feeling? If you wanna do this up, you wanna.
Excuse me,
All right.
this is the
Oh,
monthly
boy.
breakdown of, excuse me, the pots of funding that we have. But, sorry, through February. LATCF funds, we currently have an unobligated balance of $315,730.50. ARPA interest account, we currently have an unobligated balance of $207,821.35. The opioid abatement funds, we currently have an unobligated balance of $248,505.04. I wanted to share with you that I
Okay.
did just go through and look at the disbursements that we've had from the opioid abatement fund.
Mhm.
I just was looking back to see if there's any pattern, basically, that I could establish. But since August of 2023, we've received a payment in August. We have received a payment on August 29th of 2023, and that was a big one. That was $300,354. Our next payment came on June 7th of 2024. And that one was just $51,728. We had another payment on 11/27/24. That one was $120,566.
A lot of money.
Our next payment came on January 17th, 2025. That one was only $30,816.
Nothing to do with that.
And our next payment, the most recent payment that we got was on September 4th. That was $147,705.
Can you
So-
repeat that number again?
147,705. So as you can see, there's no consistency, there's no
Mm-mm.
pattern. They're just sort of all over the place.
And that's the total of what we've received.
No, we received monies prior to that. We received 1.1 million, but I didn't go back any further than that to get the breakdown.
Mhm.
So, I did reach out to the woman that sends me the email with the information for the disbursements, asking if she had any idea when we might be getting another disbursement, and I have not heard back from her at this point. So, as of right now, I cannot definitively tell you when we'll be getting more opioid abatement funding from the lawsuit settlements, because that's
Mhm.
where our payments come directly. We get our portion of the 15% that's given back to the direct litigants, so. I know that's not super helpful, but that's. what
No,
I know.
it is. I mean, it's,
Well,
well,
and
and it's good to know that it's not known.
And that what's come in the last 3 years are fairly small amounts of
Yep.
money.
Yep, yep. And so that means the opioid abatement funds, 248. That's unobligated, so that's what we have outside of our own departments, alternative sentencing and Department of Corrections.
That's what we have that's not been obligated. Period.
So so our 27 budget
Yeah,
anticipations that
right.
got,
Gonna
I'm not
take out
out of
that.
that yet. Okay, that's what I thought.
So you have a sheet in your budget binders that you probably haven't seen yet, that's in the jail section from the superintendent. That's about $40,000, that's included in his budget. But are expenses that we took from the opioid fund in this current budget that he would request to take out of the opioid fund going into 27 and would reduce his budget by 40.
Now, is this the nursing staff? Or-
No.
No,
That is just mat expenses, education and
right.
training, it's maybe some consultant services. The list is in your,
Yeah.
in your budget binders. Tim will
Okay.
go over that with you on Thursday when he meets with you, so. That would be about 40,000, and then in our current budget, we have $30,000 in social service funding
Yeah,
that
okay,
was taken out of this.
Yeah.
That was for
so
HIV
30,000 and
and
40,000
for Archways.
from DOC.
So that would be 70,000 that I would assume is being, gonna be requested in this upcoming budget. And that doesn't include, I don't know if you've gone through social service proposals yet, which are due next Thursday. But, any other funding that could potentially come from those to those agencies out of that.
And alternative sentencing, there's nothing out of there?
And
This one?
anything that Nicole has already been obligated.
So
So
Sorry,
there's no expenses in her budget proposal that would come out of the opioid fund.
So, I'm sorry, the nurses, would we take that from?
LATCF.
LATCF, and that's already shows as the obligation is already taken out.
so we're only expecting then in terms of campus support for the budget, 70,000.
Unless you find other social
Find
service
more,
proposals
right,
that,
and
I
I,
think we will.
I've looked through some of them and, not in as much depth, but just looking, ones who actually checked, could this be opioid? And then, but there are some that, even though it wasn't checked, may very well be able to be used,
Okay,
some of these
I
funds.
think you also have a couple of new agencies that reached out that we had fill out social service applications.
yeah,
And one was for juvenile restorative justice, but one of them I think was like sort of a direct opioid type thing, and I don't remember what the agency was, so.
so
We had a couple new ones.
would you remind us which of the funds are ongoing? The interest earned is ongoing.
It's pretty minimal.
But
I
it's
mean, we're only
minimal, yeah.
earning, maybe $1,500 a month in interest now. I mean, we don't have much ARPA money left. It all has to be spent by the end of the year, so.
Right,
So, I mean, we gain a tiny bit monthly on the ARPA interest, but that's it. The opioid is the only one that will continue to have monies added into it at whatever rate that happens.
okay,
So mean, I'm seeing 178,000 change or whatever, but 178,000 before the additional social service contracts. Or any other.
Oh, you
requests
mean
here.
left after you
Yeah.
deduct the,
Yeah,
after we deduct the 70,000?
yeah.
Okay,
I would suggest that, when we're looking at these dollars, and we all know how important each program is that we're asked for, that we, they can come in and present to us, but
Yeah.
with the knowledge, with the way I would look at it, is to not obligate any funds until after we go through the budget and let people know that we will be reviewing them the next time, and we can pick a date, but I think we should look at the budget and see if there's any other things that we think should come out of here. And then be able to figure out how we can approve other monies. Because when they come in one at a time, each one is important and life-saving. But I don't want to miss someone if we can spread it around a little bit or whatever. I don't know if that's clear what I'm trying to say, but I think we should do a very brief moratorium on promising funds until we could take a look at our budget as a whole and what other things, since they're coming in on pretty much a weekly basis now.
is Chief Miller, so we got that on Monday.
You got one from Chief Miller, you got one from. I think I forwarded you the Lisbon one on Monday as well, so we have one from Lisbon Fire Department and one from Littleton. Fire Department.
And are they,
I sort of conflated those.
I know.
What
do you know,
those
Commissioner,
are.
do they plan to come in?
They have not been invited to come in at this point in time. We just received them. I wanted to talk with you about
Yep.
what you want me to do as far as.
I'm trying to find.
Lisbon's is for
Yeah, where is it?
Zoll cardiac monitor for their second ambulance. And it's up in the area of $50,000, I think.
Littleton had three,
And
Think,
Littleton
but I-
had 3 different programs
Yeah.
and they total $64,000. One was mobile integrated healthcare program support, that's the $34,000 request. Community CPR and AED Heart Safe Community Initiative, that one's 15,000. And then a first responder mental health and wellness, and that one was also 15,000.
When did the Lisbon one come through? Like you, I think I conflated them, so I'm trying to
I
look.
think
for
I
it.
sent it to you yesterday morning, right around the same time with with the Chief Miller, and that's the one that said they're coming in fast and furious.
okay, yeah, both 8:16 in the morning and 8:03.
Yeah.
All right. What I did.
So I just wanted to make a comment.
Oh, there it is.
I do appreciate what Commissioner Hedberg is saying about seeing what we have. I like the idea like we did last week. I like the idea of investing in equipment. As we did for the, it saves, I'm just reading
Yeah.
Littleton's.
Yeah.
It saves communities expenses. It's cleaner than investing in staff.
Mhm.
And so I just think that the equipment, when you have something for $50,000, now that's not, Littleton's is broken down. Where'd it go? Yeah, I mean, so mobile integrated,
Theirs isn't more for equipment as it is initiatives.
Mhm.
yeah, right, I just saw that. So the first responder mental health and wellness, I don't know about that, but the Lisbon then, right?
Yeah.
Is that the one that we're looking at that's for equipment? Just like,
But I do think we need to look and see what this equipment is and if it's actually opioid appropriate.
absolutely.
I don't know
I
about, I
agree.
didn't get a chance yesterday to look up what the cardiac monitor was and if it is, and I
agree.
agree that if, well, there's both hands. If we do equipment, we can look at that, but then there are some programs, but it's hard to fund something with a small amount of money because we want to make sure that it will be sustaining in the future. Our goal is to give this money away, but I think we need to see the various asks that we have because they're coming in. Again, this week, we met with the Health Consortium this morning, and we have some in our social services that we might be able to.
One of the Littletons is equipment. Training equipment. Yeah.
Where is it?
CPR and AED.
Yeah.
Training equipment, so.
So in terms of, I completely understand Commissioner Hedberg's point, and I think it's really important that the equipment that's asked for can be used for opioid treatment, that that's what it is being used for, because that's what the grant says, or that's what the money says. I'm not so, when it comes to equipment, I'm not worried about our ability, and maybe I misunderstood, but I'm not worried about our ability to sustain that funding in the future.
No, but it needs to be, if someone hires someone, or if it's a new initiative, you would hope that they'd be able to sustain it.
Yes, and I completely agree, and that's why I think that with the equipment, even though you're right, we have to see what it is and to make sure that it's something that we can invest in. That's why I think that investing in the equipment and helping these very small local towns, is a,
Well, it gives them an ability to do their job.
well, it does,
they're-
and it doesn't obligate the county any further. I
right.
mean, we're not
Right.
looking at something where we're investing in people or initiatives. I'd be less inclined right off the bat I don't want to say less inclined to support them, but the equipment is,
Mhm.
I guess it's an easier yes, no, if it's a piece of equipment in some ways.
that's a good way to put
I,
it.
I,
That's
but
a good way to put it.
I think we're all in favor of spending these monies.
Of course
I
we are.
guess my point is I would like to not spend any of these monies this week until we have a couple of weeks to look through the budget, and see what else is coming in. And just not give a no to any of these people. I don't want them to think we're not doing it, but that we will look at it in a few weeks. And we can pick that time.
How do you feel about that?
Not funding anything this week and just waiting. Is that what you're asking?
Well, I think that's what I'm hearing Commissioner Hedberg say. I mean, I personally, I'm all for zeroing this account out and making sure we're not hanging on to it for any particular reason.
So, so
I'd like to, and I understand it would be, the priority is to go towards those social service agencies that are doing this, clearly doing the job. But
Well, and I guess my point,
I think we've already gone down the path of putting the funds out, and I think we ought to just,
so,
I think what's left, I'm sorry.
no, that's okay. Sorry.
I
I
think
didn't mean to roll.
what's It's not gonna do, a lot of, good dishing it out in $5,000 or $10,000 increments.
Go ahead.
well, my point was going to be is they've already given us applications for social services that we
Yeah.
haven't reviewed, which is why I said, let's put a couple of week hold on it so we can look at those. Because they've already done their work if we can do the opioid funds, and I wouldn't want to not be able to fund something that sent us something 2 or 3 weeks ago and something we got this week and fund it. And that's my only point, is so we can look at what we've already gotten. And again, getting this to zero and then say we don't have any more is fine with me. I would just like to wait a few weeks till we can look at the budget and look at those other things that have already given us applications that we haven't reviewed yet.
Thank you. I think this becomes for me, so I'm for zeroing it out. I'm for investing in one-time expenses like we did with ARPA. We don't want to pay for operational costs. I don't think paying for staffing is the best thing to do, because we can't sustain that. And that entails a lot of other expenses when it's staffing that, so what do I want to say? I very much support these one-time expenses from communities, just like we did last week. It seemed like that was strongly supported. And then I just want to comment on the social services. So what we've done, just, respectfully, what I'm saying, I'm throwing it respectfully out there, just in case. Respectfully, we do have a generous social services budget. And counties are picking up more and more and more, right? Are we agreed on that? Counties are being asked to pick up more and more and more.
And I see some of our more wealthy counties in the southern part of the state doing a lot. Yes, we have fewer resources, I think.
Okay. And so I think that this runs into so for me, this is kind of a bigger budget issue. So for me, this runs into the problem of what should be locally taxpayer funded. And that's why I was asking North Country Consortium this morning, how much does the state give you? The state I don't know how much, and I would bet you, I'm absolutely that the wealthier counties in the southern part of the state are doing more. But I'm a little bit reluctant to wait until what we have for this, to see what we have for the social services before we obligate anything else. I'm a little bit reluctant to have to do that, just like,
I'm not sure we have to. I think we have enough.
well, that's what
information.
yeah, I'm sorry, can I just finish?
Yeah.
Like, that was why I felt that last week with
Mhm.
with the Woodsville ambulance is, you know, the social services budget has done nothing but grow since I've been here. I'm not objecting to that right now. But what I am saying is that the county is picking up more and more and more costs, and it's enabling a lack of revenue on the state level.
I see. Yep.
Does that make, okay?
Yep. Oh, I see what you're saying.
So I'm not sure if I want to wait until we look at the social services budget.
Mhm. Well, I can go along with these two, and I would just say that if we're concerned about, because I think we have enough in here. If this is, 178 minus 114 leaves us with 64.
What's the 114?
Oh, the total of the two Littleton and Lisbon
I thought it was,
requests are 114. And then we had
oh,
178,000 without any consideration for our additional social services, which would leave us, we would have 64 to spend on that. However, we could potentially, those non-equipment pieces that Chief Miller's asking for, we could take out of LATCF,
ah,
and that would leave us with a little bit more for Commissioner Hedberg's concern.
the social services and
Yeah.
anything else that comes up. I that might be a good compromise, because number 2 on the request from Chief Miller, the CPR, that's equipment.
Right.
The first responder, mental health and wellness, that's something that all of our social service agencies need. And so I'm not so anxious to support that. I mean, I want them to be supported. But there's a lot of agencies that need that support. And then the integrated healthcare, I mean, I certainly would be in favor of, he sent a breakdown. I would certainly be in favor of supporting the community CPR and AED if it can be taken from, do we have anything? If it can be taken from, okay, here we go. This aligns with I'm reading
Yeah.
underneath, with DHHS strategy, broaden access to opioid reversal medication.
Yeah.
I would be in favor of funding that now. And I would be in favor of funding, I think, where's Lisbon again?
The same day. I would like a price, because he said about what it would cost. I think we do need a price and
Where do you find that? I can't find that.
well, I have it right under that. It says requests are coming in. Inquiry regarding use is from Julie from yesterday at 8:03. And it said that we anticipate the cost of the monitor to be in the area of $50,000. I would like a price for that. Because it would make a difference if it's ends up being more, or if it's less. I mean, because most places have given us a dollar amount of what
You're
they
talking
want.
about the Lisbon.
That's the
Where's
Lisbon one.
the-
And in the Littleton fire, I have that, the response at 8:16. It had
Oh,
come in
yes.
before that.
Thank you.
It's the one right
It's
above that.
15,000.
Yep, and that's 50, because I had asked for the breakdown.
Oh, thanks. So the 15,000, I think that's very,
Well, that's
a
doable.
strong
I-
investment.
Yeah.
The 15,000, and I'm still not able to find the Lisbon, although I
It should be
found
the
it
one
before.
the one right below that. If you, well, I don't know, I just have mine as
803.
my work one. It came in as 8:03
Inquiry regarding,
regarding, yeah, that's it.
oh. And that is how much?
He says it's about 50,000.
Oh, right there. Is that, former superintendent? Matt Champagne? No, that was Coas.
Ben is his name.
That's Ben, so it wouldn't be him, would it?
I have no idea.
Okay.
We've heard from, yeah, let's not say the right name. Miss Champagne,
Audrey.
Thank you. I was gonna say Annette, because I'm confusing that with North Country Health Consortium contact there. Audrey,
All right, so that's 15,000 plus 50.
Yeah.
If we were to fund those
mhm,
right away,
yep,
so that's 65,000.
mhm. Yep. And we could certainly state, pending the receipt, whatever the price of that is or something. Yeah.
Because most of the other ones that
Right.
have given us an estimate of what it is, and I tried to look up the monitors and, there's a variety of them, and many of them don't show prices because they want you to, contact their salesperson. And whether it's one monitor
Yeah.
for 50,000 or
For
5 monitors, for 10,000, I just certainly that we'll give it, we just need a breakdown of what they want to purchase.
So, and I'm just gonna push the envelope just a little bit, for Chief Miller, just because,
Okay.
he does make the case
Okay.
for those other 2 items. So I think what my suggestion really was,
Mhm.
and I probably misstated it, but that the other portion of his request come out of the LATC.
Oh,
So that's what I was saying, equipment out of the opioid
Yeah,
and the
I
other
think
things out
I
of.
think that's a good compromise. I would
Yeah,
support that.
I would be okay with, and it's not that I'm not supporting these, I just want to make sure that we don't zero something out
Yeah. I understand.
Before we
before we've kind of get the data in.
Yeah.
And again, I was not looking to put it off 6 months. I was
No,
looking to put it off
that's
2
understood.
weeks.
I completely understand that.
All right,
All right,
so do you
So
want to
let's
make
do
the
it.
motion?
Sure. I'll make a motion are we waiting for Lisbon? Are we?
I
going
think
to-
we just
pending
say
a breakdown?
Well, I would say
Breakdown of
that,
the cost.
Should we say up
for
to
the
50,
amount,
up to 50,000?
Yeah.
But for the.
Okay.
yeah.
So I make a motion to provide Lisbon Fire Department up to $50,000 from the opioid abatement funds for the purchase of a Zoll cardiac monitor. Yeah, that's it, I think.
Second, but I will say, I would like to see a breakdown, of what.
Yeah,
they're
I would
actually
still like to see
purchasing,
it.
so,
I would like to see that. So maybe
because-
maybe we should make it pending that.
Of
pending
exactly
the-
what they're buying.
Pending to see exactly what they're buying. I think that that's a good idea, not just up to 50,000. Is that okay?
All right, so how do you want to, just so these guys know what,
So
do it.
pending.
Well, I'm confused here. So I personally, and if you two would like to, I'm not going to deny it, but I think it would be good for us to know what they're buying with it instead of it just says a Zoll monitor, and the Zoll has many different things. And we don't know whether it's one monitor or more. That's my only
so can we
question.
just approve the funding pending receiving an estimate,
Okay.
invoice estimate or whatever it's called for the actual equipment? Does that help, you guys?
So looks like it does.
Not putting a dollar amount in,
I think
up to 50 pending the
yeah,
invoice.
up to
or-
50 pending that we see the invoice or
Or,
whatever.
or the, an estimate. Because they won't have an invoice until we approve it, so it would be an estimate.
And then
And then
don't
it's-
you want, but then you want, we're seeing that, so we're approving this pending. But what if?
pending receiving that, I mean, I think it's
But
up to
what-
Julie to
But
get
don't
back
you
to
wanna
us.
See if it's, what the equipment breakdown is appropriate. I mean,
Do you basically want to quote?
Yeah. I personally would like a quote. If other people don't care about a quote.
Quote
that's
is good. Let's
Certainly.
get a quote, pending a quote. How's that? And then, so you seconded it.
So up to 50,000 pending the
Good.
receipt of the quote, is that what you're?
Did we have a motion and a second?
Yeah.
All right, all in favor?
Aye.
Motion
And
passes.
then,
This one's a little bit more complicated, but
yeah, I'll make a motion. I'll make it really. I'll make a motion to provide Littleton Fire Rescue $15,000 from the opioid abatement fund for community CPR AED
equipment.
And
equipment
training.
and training. So let's stop there, and then the other one will be the LATCF, right?
Yeah, I think you can put them both in the same though.
We can. And then I would also include $34,000 awarded to Littleton Fire and Opioid for MIH. What is that? What?
Mobile Integrated Healthcare
Thank you.
Program.
And 15,000 for first responder mental health and wellness. So the MIH and the first responder mental health and wellness are to be taken from the LATCF fund. And so it's just the equipment, the CPR AED equipment that is coming out of the opioid abatement funds.
And his title is Community CPR and AED Initiative because that includes the Narcan. And I
Oh.
think that's an important part of us
Thanks.
approving this for the
Thanks.
opioid abatement.
Well done. Okay. So we need a second.
Second.
All in favor?
Aye.
Well done.
Motion passes. All
Look
right,
at that.
now that and the rest we're gonna hang on to until we are through our budget process. So I think that's what we have to let be clear with the public and those listening that that's pretty close to bending that down. And we will reserve the rest of it for our budget work to see where that can be
Sounds
used.
good. So that's now 65,000, so what, 113 or something left?
Yeah, something like that. So then, see what remains on this.
I have a couple of other things that aren't on.
Can I just mention though that, again, April 6th at 1 PM is the New Hampshire Opioid Abatement Fund Commission's meeting. And that I would encourage people to contact commission members that you know. In the Northern Grafton County area, we have Chief Paul Smith and we have, what's the other, Senator Rochford. I noticed that Representative Nagel is also on this. He's from the Wolfboro area, but may be helpful. And I just think people should contact and let them know that Northern Grafton County, all of Grafton County is in need, particularly of a number of things to reduce opioid use or to deal with that. So we would really appreciate an RFP that came out that allowed the county to apply for larger amounts of money to be able to address those needs in this county. And I just want to say, really, our counties do not have the money available as southern counties do. We don't have the
Right.
assessed evaluation. And anything
That's
that
the-
we ask for through our taxes is harder on people than it is in those counties where there's more property.
And that's what I was saying is,
Yeah.
I mean, that's what I was trying to say is that
Never sign it, but it doesn't make any sense.
with the county providing these services, our taxpayers are harder hit
Yeah.
than they are,
They
a
are.
heck of a lot more so than they are down Rockingham way.
Right. So we really do need the funds. All right, Julie, I know you want to get out of here, so
So municipal certification that we did as part of the public hearing for the New Hampshire Alliance of Regional Development Corporations. Apparently, because Commissioner McLeod, you didn't actually sign it. We have to have you sign it.
okay,
So
all right,
there's
got
a
it.
form to have you sign.
All right.
I don't know why the motion said or designee, but I don't try to figure things out sometimes.
I'll let you put whatever date you need on there.
So I'll, you can do whatever she
Yeah.
needs. The other thing that I have is, this is, Livermore, a contract to do, the 2026 through 2028 cyclical revaluation for Livermore. So just needs the commissioner's signature to, allow this.
A lot of pages for very little spot.
Yeah, well, you know how legalese, it's got a lot of. What is it, got two, three pieces of property?
Three.
All owned by the same, all owned by the same person. Anyways, they have to be reevaluated apparently, and so. Here's the contract to do that. Oh, 5 parcels of land.
Really?
Estimated size of the it agrees the parties that the entire revaluation consists of 5 parcels. In the event that the number of parcels exceeds the estimate, the contractor is entitled to an additional remuneration of $192 per parcel. All
When
this
are they
paperwork
gonna
for
do this?
5 parcels through
That they have to
2026
walk
through
into.
2028. Needs all 3 of your signatures
Okay.
on
Alright.
that side.
I could do it for him, actually. No basement under the little cabin. That's the only structure there is. Then there's a RV sitting up there. Oh, well, kind of. That's about it.
And well, the total tax bills were $226, so.
And they can't get to any of them because there's no road anymore. But it's a beautiful spot. I don't mind walking in 2 miles.
Thank you. That's all of the stuff, at least that I can see that I have for you in front of me at this very moment in time.
Any other commissioner issues? Not for me, thank you.
No,
Good work today.
very good work today.
Public comment? So open up for public comment. We have one hand up. Mr. DeMeo?
Yes, thank you, Commissioner McLeod. When you were talking about when the county commissioners were talking about Jim Oakes, and I think Commissioner Piper brought out step increases and merit pay. My
Yeah.
comment is the guy, I don't know who it is, but the guy who caused the mishap with the polishing of the fuel back on December 31st should not be entitled, in my opinion, should not be entitled to a step increase or a merit pay because he cost us $5,000 for that mishap. That's one thing. The other thing I was curious about, I'm trying to phrase this as a statement. Inmate pay, inmate monies, that was brought up during this meeting. What's the process for inmate accounts? How much do they get and how is it accrued? The other thing is, the North Country Health Consortium grant. That's an opioid, opioid fund. That's not taxpayer money. So I don't think that we have a problem giving them that money because it's not taxpayer money. That's the lawsuit. And the lawsuit is we get 1/10 of 15% for all the counties. So how can the southern counties be getting more money if all the counties are getting the same amount of money from that lawsuit, 1/10 of 15%? I don't understand that. Okay, thank you.
Thank you. If after we close public comment, today we'll try to address any issues that are unclear. Yeah, misunderstandings or issues that we were not clear about. Representative Spark, please, we'd love to.
Good morning, soon to be good afternoon.
Morning.
A couple things. I think it was Mr. DeMayo in the yesterday mentioned the audio. Audio today sounds great. It may be because you're concentrated with those two mics on half the table, so maybe it does make sense to get a third mic, but heard everything loud and clear, which is terrific. The budgets, it'd be interesting for the executive group, council, or even the body at large to get an idea on the social services, what percentage of other county budgets are going towards that. So are we high or low compared to those other counties based on our overall budget? I would think that could be gleaned or gotten together. It would really help us, I think, understand, are we above the average, below the average, and what other counties are doing and where we are with that. And the other observation was with some of these nonprofits that we're funding, and you were talking about casinos and opting in, opting out. It's an opt out. And the casinos, I think there are 14 right now. There's a 15th that's being built, and the New Hampshire allows up to 18 right now under their current licensing. And I think that's probably the max where we'll be with that. But there's a substantial increase in revenue that's going to the charitable portion of gaming, substantial. And I've introduced it to a number of nonprofits, and I'd be happy to, I think just for you all to be aware when you're speaking with some of these nonprofits who are soliciting the county, to ask them if they've researched or looked into that as a possible revenue stream. The one that's fairly close to us, I guess closest might be considered the one down in Lebanon. And that one last month alone in January, I have January's records, gave $300,000 to charities just in that month alone, substantial amount. And it's unrestricted funds, so they can use it however they want. So I think I'm happy to talk with any nonprofit too, if there are people that you know who might benefit from that. I'm happy to get on a phone call and go through the details with them. I'm on the Charitable Gaming Commission, so I'm fairly aware of what's happening there. And so I would look at that as certainly something that we could do. And like, for example, I don't know about the gentleman from NCHC, but have they looked into that? Because that could be another source of revenue for their budget. I think that was it. And thank you for all you do.
Thank you. All right, well, is there anything else, anyone else online? I don't see any hands up. All right, so we'll close the public comment section of our meeting. And let's address a few things here that we can do. I think the inmate accounts, we're not paying them for this. These are accounts that they have their family often puts money in that they can use. Is that correct?
Yes, inmates we don't pay inmates anything.
Right.
And inmate accounts refer to each individual inmate as an account with their own money that they
Right.
use to purchase commissary, make phone calls.
Yeah.
Etc.
The NCHC request is for almost, I believe it's for $500,000. And we don't have that. In fact, what I figured we have just under what would be a 1 year cost for them expenses. So that is really why we aren't considering funding that, and why we're looking at bringing in more opioid abatement funds, perhaps from the state level, to be able to support that, particularly as they support our efforts in the mental health and drug courts. And I just want to thank Representative Spar for that information. It's very helpful and good to know that we've got an expert, somebody on that commission who has that information that we can refer folks to.
Can we just do can I just offer a quick update on the disbursement of opioid abatement funds we don't get 1/10 of the 15%. There are 23 direct litigants in the opioid abatement lawsuit. 15% of any settlement funds that come in get dispersed to those 23 entities based on population. So Grafton County does get a much smaller portion of that percentage than say a Rockingham County or Hillsborough County or whatnot. So they're not evenly distributed to the 23 litigants. They're dispersed over by population to the 23 different litigants. It's not just the counties. There are also 13 towns or cities in the county, in the state that were direct litigants as well.
Is there anything else that people want to clarify or? Okay,
I will make a motion to adjourn.
Second.
all right, so moved and seconded and all in favor?
Aye.
All right.